Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common mental disorders affecting the pediatric population. In this episode of Hope in the Pipeline, we will dive into the topic of pediatric attention deficit and hyperactivity disorder and how volunteering to participate in a clinical research trial testing a new medication for ADHD can be a big key to helping develop better treatments in the future. Hello, I'm Dr. Paul Wylie, neuropsychiatry and sleep medicine specialist and the medical director of Preferred Research Partners. The three primary problems caused by ADHD include inattention, hyperactivity, and impulsiveness. ADHD can impact many aspects of quality of life, including academic performance, family interactions, group and interpersonal relationships, and completion of routine daily activities. In some cases, these lead to poor self-esteem, lower grades, and difficulty with social functioning in children affected. It is estimated that about 8% of children have some form of ADHD, and sometimes ADHD persists into adulthood about 3% of the time. ADHD can first be identified in preschool to the first grade years, when it leads to disruption in the classroom or problems with schoolwork. ADHD is more commonly identified among boys than girls. However, this does not mean that boys are more likely than girls to have ADHD. In general, boys tend to present with significant hyperactivity and impulsiveness, which creates behavioral disruptions that attract negative attention, whereas girls tend to have more problems with attention and often remain somewhat hidden. There are three basic subtypes of ADHD. Number 1, primarily inattentive, or known as ADD. Number 2, primarily hyperactive and impulsive. And number 3, the combined type. Inattentive symptoms include a child that doesn't pay close attention to details or makes careless mistakes in school or job tasks, has problems staying focused on tasks or activities such as lectures, conversations, or long reading assignments, does not seem to listen when spoken to. In other words, their thoughts seem to be somewhere else, does not follow through on instructions, and doesn't complete schoolwork, chores, or job duties, and may start tasks but quickly lose focus. A child has problems with organizing tasks and their workload. For example, they don't manage time well. They might have messy, disorganized work and miss deadlines. Some kids avoid or dislike tasks that require sustained mental effort, such as preparing reports and completing forms. Often those affected may lose things needed for certain tasks or for their daily life, such as school papers, books, keys, wallets, cell phones, and glasses. Kids that are affected often forget to perform their daily tasks, such as doing daily chores or even running required errands. Older teens and adults may forget to return phone calls, be late for work, and fail to keep appointments. Hyperactive impulsive symptoms include fidgeting with or tapping hands or feet or squirming in the seat, inability to stay seated in the classroom or workplace, running about or climbing in places where it's inappropriate, inability to play or do leisure activities quietly, being always on the go as if they're driven by a motor, talking too much, including blurting out an answer to a question before the question has ever been finished. For example, they may finish people's sentences or can't wait their turn to speak in conversations. A child may have difficulty waiting for his or her turn, especially while waiting in line. There can be interruption or intrusion upon others, for example, cutting into conversations, games, or activities, or starting to use other people's things without permission. Older teens and adults may take over activities that others are already doing. Now, these symptoms must start before the age of 12 and cannot occur only at home. Not every patient will have every symptom, and the combined type will have some of each of these two groups of symptoms. The source of ADHD is unknown. We have not yet identified the specific causes of ADHD. Notice that was plural, causes. There is significant evidence that genetics contributes to the development of ADHD, as relatives of individuals with ADHD are often also affected. There is evidence of anatomical difference in the brains of children with ADHD in comparison to children without the condition. For instance, some children with ADHD have been shown to have reduced gray and brain white matter volume and demonstrate different brain region activation when performing certain tasks. There are several non-genetic causative factors that have also been linked to the disorder, such as low birth weight, certain foods, premature birth, exposure to toxins during growth and development in the uterus, such as alcohol, smoking, or exposure to lead during the pregnancy. And extreme stress during pregnancy has been identified as a cause as well. The essential problem in ADHD is lower than normal levels of two brain neurotransmitters, dopamine and norepinephrine. They are lower in areas of the brain such as the prefrontal and frontal cortex, the basal ganglia, and the limbic system. These areas of our brain control important things such as our behavior, emotions, attention, our response to awards, impulse control, decision-making, organizational capacity, motivation to perform tasks, planning and execution of tasks, and multitasking. Many young children diagnosed with ADHD will continue to meet criteria for ADHD later in life and may show impairments as adults requiring ongoing treatment. However, just as frequently, a diagnosis of ADHD is simply missed during childhood, and as a result, many adults with ADHD do not realize that they even have or had a form of the disorder much earlier in their life. Treatment for ADHD usually involves a combination of therapy and medication interventions. In preschool age and younger children, the recommended first-line approach is behavioral strategies in the form of things such as parent management training and school intervention. So parent-child interaction therapy is an evidence-based therapy modality commonly used to help young children with ADHD. Students whose ADHD impairs their learning may qualify for special education considerations under the Individuals with Disabilities Education Act, or more commonly for a Section 504 plan at their school. Students with ADHD can often also benefit from study skills instruction, changes to the classroom setup, alternative teaching and testing methods, for example, getting longer time to complete their test, and even a modified curriculum. But behavioral therapy alone is often not fully effective for treating ADHD, and so two types of medications, amphetamines and methylphenidate, have long been used as first-line treatment options. These two substances are very controlled medications, and they work by causing increases in the brain levels of dopamine and norepinephrine, resulting in a reduction of inattention and hyperactivity symptoms. But they are not effective in everybody, and they can cause things such as mood problems and cause blood pressure to be elevated. There are a lot of patients for whom those medications only help partially. So sometimes the use of what are called alpha agonist medications is helpful. This category of medications include things such as clonidine and guanfacine, which, when added in to amphetamines or methylphenidate, can be helpful with some of the behavioral aspects of ADHD. But, unfortunately, they can cause sleepiness even in the daytime, despite sometimes, most of the time, being given at night. Over the past few years, Preferred Research Partners has participated in clinical trials to help develop new medications for ADHD, such as atomoxetine, Jornay, Quellbry, Adhansia, Dianavel, Midasis, and centanafidine. These new medications have generally provided advances, such as a longer-acting beneficial effect, or more complete effect, or they have resulted in fewer side effects. Lastly, we have helped develop some medications for ADHD that are not controlled substances, so this allows for easier access to the medication. Lately, we at PRP have been focused on getting FDA approval for use of medications to treat ADHD safely and effectively in the 4 to 6 year old population. And I'm pleased to report that Preferred Research Partners is currently privileged to serve as a site partnering with Supernus Pharmaceuticals for the investigation of a new treatment for ADHD in this younger 4 to 6 years of age group. We are currently looking for individuals, specifically 4 years old to 5 years and 7 months old, who either have ADHD or if they might have ADHD, to help further test the effectiveness of this non-controlled medication. This medication is already FDA approved for use in adults and kids down to 6 years of age. This is a paid clinical trial, and participation in this research can include the additional benefit of our site staff making an initial formal diagnosis of the ADHD in the 4 years to 5 years and 7 months age group if necessary. So if you or a loved one or a friend knows someone with a child ages 4 to 5 years, 7 months who has or might have an ADHD problem and think that they might be interested in exploring the possibility of joining this clinical trial, please check out or direct them to our website at preferredresearchpartners.com to learn more. Now, one last thing I want to mention. My professional experience in psychiatry and sleep medicine has made it clear to me that there is at least one more clearly definable subtype of ADHD beyond just inattentive, hyper, or mixed. And I call it the insomnia subtype. And it doesn't get enough attention. This subtype can be present within both the inattentive and the hyperactive types. Please don't underestimate the importance of good quality sleep and an adequate amount of sleep each night in alleviating ADHD symptoms. I've seen some pretty impressive ADHD symptoms get 90% better just by correcting the child's sleep difficulties. Sleep problems in ADHD can be chemical or behavioral in nature, or a combination of both. Don't be afraid to utilize medication to help with sleep if your child with ADHD struggles with insomnia. Utilize behavioral techniques to address nighttime oppositional or unhealthy sleep behaviors. In fact, I'm going to give you guys something. There is a great behavioral resource. It's a book by Dr. Richard Ferber called Solving Your Child's Sleep Problems, and it's available on Amazon and at bookstores. I highly encourage you to utilize this book because a child that is resisting sleep at night and fighting sleep during the day is often a hyper child. As always, please like, rate, and review our podcast, which helps more people to find it and to learn from it. If you know someone who you think might benefit from viewing this podcast episode, please share it with them. As always, thanks so much for listening to today's Hope in the Pipeline, and we'll see you again next time when I talk more in depth about insomnia in the adult and pediatric populations.